Disease overview. Diffuse pulmonary lymphangiomatosis, DPL, is a disease in which the overgrowth, proliferation, of lymphatic vessels, lymphangiomatoses, occurs in the lungs, pleura, and typically the surrounding soft tissue of the chest, mediastinum. Lymphatic vessels are part of the lymphatic system, which includes lymph nodes, the small nodules where certain white blood cells, lymphocytes, and other cells participate in the immune regulatory system of the body. Signs and symptoms. The symptoms and severity of DPL are variable and there is no typical or standard presentation for the disorder. Some individuals may eventually experience life-threatening complications, while others have mild symptoms that can go undiagnosed well until adulthood. The specific symptoms associated with diffuse pulmonary lymphangiomatosis depend upon the size and exact location of affected lymphatic vessels. The disorder often causes a variety of general, non-specific symptoms including fatigue and nausea, as well as symptoms more directly related to the chest, including chest pain, wheezing, shortness of breath, dyspnea, chronic cough and coughing up blood, hemoptysis. Diffuse pulmonary lymphangiomatosis can eventually cause compression of nearby structures in the chest, bony destruction leading to the appearance of holes in adjacent bones, lytic bone lesions, and other complications such as the accumulation of lymph fluid, chyle, in the space between the lung surface and chest wall, pleural space, a condition known as chylous pleural effusions. The excess fluid in the lungs and other spaces also can lead to severe infection, as bacteria can grow in these excess fluid pockets. Causes. The exact cause of diffuse pulmonary lymphangiomatosis is unknown. Lymphangiomatoses in general is believed to result from abnormalities in the development of the lymphatic vascular system during embryonic growth. Affected populations. Diffuse pulmonary lymphangiomatosis affects males and females in equal numbers. The disorder has been reported in individuals of every race and ethnicity. Disorders with similar symptoms. A wide variety of conditions may have symptoms that are like those found in individuals with diffuse pulmonary lymphangiomatosis. Such conditions include congenital pulmonary lymphangiectasia, lymphangioleiomyomatosis, LAM, hemangiomatosis, proliferation of blood vessels as opposed to lymphatics, various disorders associated with bone loss, osteolysis, such as Haji-Cheney disease, and various tumors or malignancies including kaposiform, hemangioendothelioma and Kaposi's sarcoma of the lung. Gorham's disease, which is also known as vanishing bone disease, is a rare bone disorder characterized by bone loss, osteolysis, associated with overgrowth, proliferation of small blood, vascular, or lymphatic vessels. Areas commonly affected by Gorham's disease include the pelvis, shoulder, spine, ribs, jaws and skull. Diagnosis. The diagnosis of diffuse pulmonary lymphangiomatosis is based upon identification of characteristic symptoms, a detailed patient history, a thorough clinical evaluation and a variety of specialized tests. Because of the disorder's rarity and varying presentation, obtaining a correct diagnosis can be challenging. Treatment. Specific therapeutic procedures and interventions may vary, depending upon numerous factors, such as disease severity, the size and location of the lymphatic abnormalities, the presence or absence of certain symptoms, an individual's age and general health, and/or other elements. Decisions concerning the use of drug regimens and/or other treatments should be made by physicians and other members of the healthcare team in careful consultation with the patient or parents based upon the specifics of the case. A thorough discussion of the potential benefits and risks, including possible side effects and long-term effects, patient preference, and other appropriate factors. A wide variety of potential therapies have been tried in individuals with diffuse pulmonary lymphangiomatosis. Due to the rarity of the disease, there are no treatment trials that have been tested on a large group of patients. Surgical removal, excision, of affected tissue can be performed and has been effective in some cases when the disease is more localized. In addition, It may be impossible to remove all the diseased lymphatic tissue because of its location near or around vital organs. Thank you for watching. Please subscribe for more videos. Your like, comment, and share always motivate us.